this is what people are saying. So this was the first, one of the first big articles was in Scientific American, and that was the headline: "Science lags as health problems emerge near natural gas fields." So basically, we don't have the science. That was kind of a very, like an important call. And in the same, okay, I'm going to get to it later, but in the same issue in the editorial, that they came out with a very important statement. So why don't we know more? I mean, first of all, we don't know more in part because this is relatively new. So, given that. But there are also other reasons. So there are certain entities, certain forces who don't want the answers. So if you look closely, what you'll find is a pattern of making sure the questions aren't asked or the information isn't recorded. So the Colorado Health Impact Study that was started was dropped after the first draft. The first, not the one that came out most recently, but a number of years ago in 2010, it was commissioned by in the Battlement Mesa area by I think the town council, it might have been the county. And it was again done by the Colorado School of Public Health. They developed a sort of strong draft, which had pretty condemning information in it. And the way it's described, because of course nobody knows exactly what happened, but the way it's described in Scientific American is there was I guess it was municipality. So there was a municipal election, outside money came in, and the person who was elected decided to discontinue the study. So, and what you hear from the industry is, you can't refer to that, it was never finalized. We don't know, it's only a draft. So that's one. There's incomplete monitoring of the chemicals that are known to be released in gas-producing areas. That's a pattern. In New York, these two examples are really quite astounding. In New York, they've done this huge environmental assessment process in like 4 years, very detailed, pretty transparent in the sense that it's all public, so that there's been a lot of misinformation coming out from the study that has then been critiqued. So that people were actually able to see, okay, this is what we think is going to be the effect of this, or this is what's going to be the impact of that. But it was all made public, it was all written down, and then you had people able to study it and say, well, look, when you're looking at the jobs, these numbers are not right. And there's a whole really interesting study that says, well, look, you're saying it's going to be, this is a sidetrack, but 125 jobs per well. When it was analyzed, it was actually 2. So, but at least it was transparent enough that people can have been, so it's been fought at every step of the way. This isn't right, this isn't right, this is distorted, this is based on this erroneous information. So, but health wasn't part of it. Wasn't part of it at all. There was a lot of pressure from the Medical Society in New York and doctors. So there was a bill passed, and so they've got two houses in every state, right? And I think the bill was passed in the legislature to allocate $100,000, not very much, to try to look at what the potential health impacts might be. The other house, whichever it was, dropped it. So, do you want the answers? Don't ask the questions. Pennsylvania's even a more striking example. So Pennsylvania's in the midst of this huge gas boom. The governor said they were going to put $2 million into developing a health registry. So they would actually document the kinds of, just like we have cancer registries, so they would document, the diseases that were likely to be associated with exposure to gas areas. This was very important, the governor said. And so at the last minute, when the budget was passed, it was gone, just disappeared. No public discussion. And instead of that, what we have is a new law that says that doctors actually can get some of the confidential information on fracking fluids, but they can't release it to their patients. And that got slipped in. So one got slipped out, one got slipped in. So again, make sure that people don't have information. So these are the kinds of things that have been hidden. So the fracking fluid composition, and be really careful when you read, and the Premier here says there's going to be disclosure, but he doesn't say there's going to be full disclosure. There has never been full disclosure. Every time they've passed a law in a state that said there would be full disclosure, it gets amended, so it's disclosure of what the company's prepared to disclose. The information about the radioactivity in wastewater was hidden. The gag orders are hiding all sorts of information. There's incomplete records, and like the restriction on Pennsylvania doctors. There's a pattern of hiding information. This is partly why we don't know more, and partly why studies weren't able to be done about, like, because no one knew about what was in the fracking fluids. That's why Theo Colburn's work was so important, and there had to be a whole U.S. congressional committee that required the companies to reveal most of the information in fracking fluids. So why? This is, if you're hearing all this stuff and you're hearing comments from the industry and you're saying, this is crazy, how can they be saying this? This will explain to you why. And I highly recommend a book called Merchants of Doubt, which is actually, it's traces how industries have used disinformation, public disinformation, to counteract evidence of harm from different things. And the first one was tobacco. This is such an incredible quote. So, doubt is our product. Okay, not truth is our product. Doubt is our product. It's the best means of competing with a body of fact. That's what we're seeing. We see, if you start looking at what's going on, you know, there's all sorts of examples of raising doubt. When we say, you know, okay, the EPA found that there was well water contamination. Oh no, the EPA contaminated the aquifer by themselves. Or, you know, we don't know that. Or you just deny it. You just deny it. So, because it's a means of establishing a controversy. So that's the other thing. And actually the interviewer from Schiff today said to me, well, you know, there's all these arguments for and all these arguments against. But the thing is, some of them are based on fact and some of them are just based on really, really good PR. You know, you just keep saying there's never been any well water contamination. And people think, well, there's really a debate on this. Well, there isn't actually, there's a debate, but there aren't actually competing facts. So that's an example of manufacturing doubt. Okay, so we have, you know, these patterns. So when you say there's no proof of harm, it doesn't mean that there isn't harm. It just means you can't prove it. So this is what the industry is consistently trying to do, is make sure we can't prove it. Or, you know, so that's a piece of the manufacturing doubt. So these are some examples. Okay, so controversy, fracking is completely safe. It's impossible for methane to contaminate a well. Well, now we have a study, you know, that documents that really elaborately. And that actually was peer-reviewed, but I didn't include it in the health ones, but it is peer-reviewed and published, where scientists from Duke found levels of methane that were 17 times higher in water wells close to fracking sites than, I think it was a kilometer. Well, it wouldn't be a kilometer in the States, maybe a mile, whatever. So, I mean, they have to, and there's two kinds of methane. So the company has always said, companies have said, the industry has said, that's not methane from the shale layer, that's surface methane. But now scientists can essentially fingerprint methane. So stuff from the shale layer is called thermogenic. Yeah, and the other one is biogenic. So they've fingerprinted the methane found in wells and found that it is thermogenic methane. It comes from the shale layer. How exactly it got there, we don't know. But it came from the shale layer and it didn't come before fracking. So that's another, this doubt. Okay, so the thing about we need shale gas, it's a clean bridge fuel, that's, you know, we've got a lot of information. I'm not going to even go there. Environmentalists hate development. And that's a great example of just changing the debate. Let's not talk about shale gas. Let's talk about these crazy environmentalists and how they hate development. Just make up anything that makes it look like this is all, you know, kind of crazy. And this, I love this one, raising health issues, it's a fear tactic, you know. You're not. You're not supposed to talk. This is really, you know, not right. You're bad because you're making people scared.
That's because we're scared.
Yeah. Well, I can't say I'm not, but you know, I mean that's not the point. The point's what are the facts. Should we? I mean, if a tiger is coming at you, it's probably right to be scared. You know, so maybe it's wise to be scared.
Talking about that tiger is just a fear tactic.
Yeah, I'm sorry, Steve. I won't do it again. Okay, you're gonna like this. I love this one, and I know this presentation is long, but I cannot leave this one out. So this comes from the Natural Resources Defense Council, and this is their analysis of how the chemical industry stops governments from regulating them. So, and I have my variation on what this means in terms of this issue. So, my dog doesn't bite, okay? So, fracking is completely safe. My dog doesn't bite at all. Okay, my dog bites, but it didn't bite you. So, yes, there's some chemicals in fracking fluids that, you know, could be toxic, but they never got into drinking water, you know? So, you know, maybe it bites, but, you know, what's your problem? My dog bit you, but it didn't hurt you. So, okay, there's methane in your water, but methane isn't toxic. Actually, methane hasn't ever been studied for safety. So because it hasn't been studied, they can say it's not toxic because it hasn't been shown to be toxic. So there's your, you know, there's no proof. So it didn't hurt you. Okay, my dog bit you and hurt you, but it wasn't my fault. So that's the, okay, so fracking fluids have contaminated, or fracking fluids got into this stream or pond, but that wasn't fracking. Fracking didn't do it. There was this valve that broke or this truck that turned over. So, you know, it wasn't my fault. It wasn't fracking's fault. You know, it was like that stupid truck driver, the guy who didn't turn the valve. It's not the industry's fault. And then I had to add in the fifth dog. So some dog bit you and hurt you, but you can't prove it was my dog. So I think that's the Pavilion, Wyoming example. So, you know, there's fracking fluids in the aquifer. It's consistent with gas migration, but you can't prove that it was us that did it. It might have been the EPA. So keep these in mind when you hear these really nutty arguments and you think they don't make sense. They're part of a pattern. I like identifying patterns. That it helps me make sense of things that don't seem to make any sense. And I have just see this over and over, this pattern coming up, some variation of either the manufacturing doubt or the five-dog defense. So what we don't know can hurt us. I think I don't have to convince you of that. But one of the pieces of information I found really interesting is in BC, federal air standards, and that's what the Premier has said, we will rely on federal air standards. They actually only measure half of the emissions from shale gas fields. Okay, they only measure large point source emissions. They don't do small ones, and this is anything that doesn't, I think it's 10-person, sort of 10 full-time jobs per year. That's what they measure, and these wells don't reach that standard. The same kind of thing happened in Colorado. I've got a little bit more information. And also the federal standards don't require measurement of the specific chemicals that are emitted in the shale gas area. In Colorado, there were only toxicity guidelines for 20% of the contaminants that were identified in the air samples. So that means that for most of the chemicals that were found, we don't know what safe levels are, safe levels for health. They don't have existing, you know, that science hasn't been done. So there's no way of knowing what the health impacts are. So, and if you flip it around, there's no way of knowing what would be safe. We don't have the information to know what would be safe. I really like this example because in Colorado, what they were able to do is to find out that the setback, so the setback is here's a house and here's a well. This is the distance you have to have between them. was 350 feet, 100 meters, okay? It was based on a standard in Alberta. So then they said, okay, so you could say, okay, well, we've established it, what the government would say, we established our standard based on the standards in Alberta. But somebody decided to go beyond and say, okay, so what were the standards in Alberta based on? Well, death from exposure to one chemical, hydrogen sulfide, okay? So I think you can see what's missing. It didn't address long and short-term health effects of exposure to all the other chemicals, anything short of death from one chemical. So that standard is absolutely not protective for the kinds of exposures that people are going to be experiencing from shale gas. It's a standard, but it's not based on any scientific study for health. So in fact, and this you I'm sure can use, there are no known studies that document the safe distance between a well and a home. Your premiers come up with an idea of a certain amount of distance. Probably is a little bit, it's certainly bigger than the distance in Colorado, but nobody knows if that's safe. You know, we're talking about flaring gas wells with benzene and toluene. We're talking about homes with children, pregnant women. We're talking about a shorter distance for businesses, so where are those women going to work, you know, when they, in their early weeks of pregnancy? I mean, there's all sorts of issues. But the big thing is we don't know. So, and then there's all the extra issues about mixtures of pollutants which are known, which are very, very difficult to measure, to document sort of, but we do know from some pesticide studies that, let's say that 100 is a safe level of one pesticide and 100 is a safe level of another pesticide. It could be that levels of 25 and 25 of both pesticides, which are often used together, create even more significant effects than 100 of each separately. So we don't know that. That's really, really hard to, I mean, scientifically, it's very expensive to do that kind of scientific study. So this is what people are saying. This guy is one of the top scientists in the US, involved with several agencies that deal with environment and health. So he's saying that there is evidence of environmental illness. We need to study it more. In some communities, it's been a disaster, and we don't have enough information to draw conclusions about how much of a public health risk this is. And this is, he's a government employee, so for him to go this far is pretty significant. He also said we have to have more studies to determine how people can be exposed through air, water, soil, plant, and food, plant and animals. There are no soil studies anywhere been done on this. Like, so in places like Texas or Wyoming or Colorado, where it's been going on for a while, there's nobody studied whether the contaminants have been carried, you know, and are in soil, whether they're being taken up in plants or, you know, eaten by animals. And so there are even potential agricultural issues. There's certainly agricultural issues in terms of animals and weight gain. And I've read a couple of comments from people. This is the quote that I find is very compelling. So again, Scientific American, which doesn't usually, they don't take positions. This is, you know, a scientific magazine, usually just sort of presents information. So drilling for natural gas has gotten ahead of the science, needed to prove it safe. All these states are flying blind. I mean, that says, this was November 2011. This is 6 months ago. This is not for 7 months ago, not very long ago. A long list of technical questions remain unanswered. So it seems to me, when they remain unanswered, how can you write regulations that are going to be protective of anything, health, environment, streams? There's no studies about a safe distance of setback from a well pad in a stream. No, none. It's not just health. So, and this I think is really also very interesting. So BC, where supposedly everything is great, the medical officer of health for the northern region, which is where there's a humongous shale gas development complex, not a lot of people, native community, which of course gives governments more license even to ignore people than even tiny rural communities. So we've got that pattern of valuing certain people less. So they've been reporting health problems. He's been asking for air quality sort of sampling and analysis, a study for years. Finally, after 3 years, the government agreed to do it. But this is sort of his comment. I think it's going to be really difficult to do the right thing. And I think that's really the lesson for all of us. Once it gets a hold and it's started, it's really difficult to do the right thing. It's really unlikely that the right thing will be done. There'll be some kind of compromises. Maybe we'll make it a little less bad, but doing the right thing is much less. And that this, you know, do we have the courage to shut down certain areas for gas development? When you hear that from the medical officer of health, that's pretty strong. I'm just going to skip this because it gets covered. So another point just to remember is that these are involuntary exposures. It's not like buying a can of soup. You say, okay, it's on the label. You have to tell people what's on the label. Well, even if we knew what was in the air, we can't opt out of breathing it. You know, we can't sort of say, oh, you should have the right to know and just stop there. You know, the right to know isn't going to protect us. So, so where we're at is we know there are risks, we know there are toxins, we know there's routes of exposure. We know there's evidence coming out about health problems, not solid evidence in the provable sense, but those kind of preliminary indicators like the breast cancer and the asthma in Texas. We know there's humongous gaps in what's known, in what's recorded, and what's studied. And so regulations aren't going to be based on any solid science. We also know the stakes are very high because of the scale of the industry, because of the kinds of problems that could arise. So when you have that kind of situation, you know, what can guide us? So that's where we get to the precautionary principle, which is actually enshrined in the Canadian Environmental Protection Act. I think it's still there, apparently. I checked with someone. I just thought it was probably gone, but it's even, no, that act didn't get cut. It's probably still could, but yeah. So, but it's also in the Nova Scotia Environment Act, which has been very useful to us. So this, I think this is the bottom line. When it comes to hydrofracking, the guiding principle should be first, do no harm, and that there's a need for scientific and epidemiologic information on the health impacts. And this is, so frankly, no one should be unleashing even more fracking before we have the scientific facts. And his statement is this is globally. You know, it's not just, he's from New York, but he's saying this just shouldn't be going on. We don't know where this is leading. The Medical Society of the State of New York supports a moratorium. The New Brunswick College of Family Physicians is now calling for a moratorium, thanks to somebody who's in the audience who raised a resolution at one of their meetings. The medical staff of Sackville Memorial Hospital, the medical staff of the Moncton Hospital, and they're all calling for a moratorium for more or less, we're not talking a 6-month moratorium and not a moratorium until regulations are written, but a moratorium until there's valid evidence to determine what the health impacts could be and whether it can be done safely, and if so, how. So like wait until it's the same thing as Adam Law says, is wait until we have the studies, and those studies are going to take a minimum of 10 years, and longer if they don't start doing them. The longer they put them off, the longer we're going to have the evidence. So this is really talking about a longer term moratorium. So this is another thing that I kind of realized this after I'd been thinking about this a lot, is that both the Nova Scotia government and the New Brunswick government and New York and all the places where people are trying to make sure this doesn't start, they all start with this idea about let's just have regulations. So, and they're saying, well, that's what they're doing in the States. But in the US, where they've already got this industry like pretty widespread in some states, for those states, it is sensible to say let's have better regulations. It's really unlikely, like Badenhorst said, it's really unlikely that they're going to do the right thing and shut down the gas operations. So making it less harmful makes sense. But that doesn't mean that's the right model for us. The way to make things less harmful here is don't start. That's the next step. That's the only sensible next step. So we can't get sucked into, well, that's what they do in the States. They're going to, make better regulations. No, and not in New York because they don't want it at all, and not in there's other states that are trying to say no, no, no as well, just the same way we are. So again, so, and here's another idea. So I said to the Telegraph Journal yesterday, I said, if shale gas was a pharmaceutical, it wouldn't be allowed on the market. Okay? It doesn't have a record of safety. It hasn't. So if you use standards for safety and health, there are certain expectations. Shale gas hasn't met those expectations. When Tony Ingraffia was here, and I think probably a number of you heard him too, he's the professor from Cornell who's got a 25-year background in rock fracture mechanics and has worked for the oil industry. He said to us, he also worked in aeronautical safety. He said the standard for aeronautical safety is the risk of 1 in a million of a crash, okay? And then he pulled out this, chart of oil well leakage, and he showed us, this is a chart from the industry, that in the first year, 5% of wells leaked. He said, that's not an acceptable, that would never be accepted in aeronautics. It probably wouldn't be accepted in pharmaceutical safety. So why aren't we using those kind of standards as safety? Well, because we're not running the government, but why isn't the government? So talking about regulations before understanding risks is putting the cart before the horse. And need to apply the precautionary principle, and this is what it says. This was developed by scientists in 1997. It was developed for exactly these kind of situations where all the scientific evidence isn't in, but there's a really big potential of harm. So people were getting caught time and time again in the kind of dilemma we are. Well, you can't prove it. So this is a principle that says when there's serious, widespread, or the chance of serious, widespread, and irreversible harm, when you've got evidence that all of these things are possible, then even if we don't know 100%, we can't prove cause and effect 100% that frac caused this well to go bad, but there's, some pretty good evidence. Then the burden of proof has to be on the industry, not on us to prove it's not safe, but on them to prove it, that they can do it, that they are doing it safely. That there has to be informed, democratic, transparent consultation, and that we have to look at all options, including the alternative of no action. So the precautionary principle is the basis for either a ban or a moratorium, that no action is an appropriate step when there's significant chance of harm. And so it's a different way of looking things. It's a principle, it's not binding, but it's a way of looking at this kind of situation. It fits exactly a situation like fracking. I mean, there's very few situations that have the chance of such widespread, serious, and irreversible harm as contaminating water and, creating huge amounts of toxic waste that have no way of being disposed of safely, and hurting people's health both in this generation and potentially in the next. So when I sort of talk with health groups particularly, because I know I don't have to convince you guys of this, but health groups talk about evidence-based medicine, evidence-based positions. They don't want to just kind of jump to a position without evidence. But then we have this dilemma of the evidence is being suppressed. So do you allow an industry that's successfully suppressing evidence to continue to go on just because you don't have the evidence? So it's a bit of a catch-22. So this is my belief. My belief is that there is enough evidence for this kind of position. Slow down, do no harm, make sure health issues are part of the discussion, and adopt a long-term province-wide moratorium on shale gas, including fracking, until the risks can be fully evaluated based on valid information, and that there's no informed decision-making unless we do that. So I think there's enough evidence for that. That's what I talked about when I talk with health groups. That's essentially what the physicians' organizations here have said, that along those lines. So this is from the Bamberger study, and I think, remember that it's considered unethical to use human subjects in a scientific study without their permission, okay? And so what they're saying is, without rigorous scientific studies, the gas drilling boom is going to remain an uncontrolled health experiment on an enormous scale. You know, that's what it is. We're potentially the guinea pigs, and we have a right to say no. We don't want to be guinea pigs. So that's the conclusion, that health issues have a place in this, and that you can't have healthy people without healthy environments. And I don't need to tell you this, but it's a nice way of ending.
Hours and hours and hours that you must have put into this.
A year.
And it's a year. It's a year of your life well spent, because it is done for the people of this community, this province, as much as it's done for the people of Nova Scotia.
And other provinces too.
And we owe you a lot for your really excellent. So first thanks to you. And my second thanks really is to the people of Taymouth, because this is my third trip to this community. This is my third trip ever in my life to a gathering of this nature to protest something that our government seems to be ready to go ahead with without thinking about what they're doing. And this is what really troubles me. I was born in New Brunswick. I've lived here all my life except for the years that I spent out of the province to get my education. I've lived here all my life. I chose to live here. It's my favorite place in the world. And I really could have lived anywhere and worked anywhere. But I chose New Brunswick. And I still like it for what it is, not for what some company from the United States wants to make it, which is really just another industrial waste site. Because that's really what we're facing. And we can't let it happen. And it's people like people here that will stop it. And I know we will stop it. Because it just can't happen to such a beautiful province. What really I have to say is that we know from what the geologists tell us is that the gas that's in the ground has been there for 300 million years. And is not going anywhere. So why in a period of 2 years, because that's about as long as this has been out of the barn, why in a period of 2 years are we told this is going to happen? We need really to tell our government in no uncertain terms, and in every way, every voice possible. And if it takes lying down in the middle of the road, then lie down in the middle of the road, because I'm willing to. Because this process has to stop. There has to be a moratorium. And then we can look at what could happen. And 30 years down the road, or 20 years down the road, we can make a decision. But we can't make it this year, or next year, or the year after that. And this government has to hear that loud and clear. They have no moratorium to go ahead with this. They didn't take this as an election issue, but suddenly, soon after the election's over and they're in power, they're saying they're going ahead with it. And then other times you hear, well, they're blaming it on the Liberals. The Liberals signed the initial contracts. I don't care what party it was. The politics is not what matters to me. It's my New Brunswick, my province, your province, a place that we've chosen to live, a place that's safe and clean, and we want to see our children and grandchildren live here for years and years to come without worry of all the industrial pollutants that will be exposed to the water, to the air, to our animals, to our fish, to everything that's important in this province will be gone and will be a toxic waste site. And we can't have that. And our government needs to know that. We need to stop this. We need to go home and go to sleep tonight knowing that this can't happen. And we won't let it happen. So thank you.
Absolutely. Thank you.